Uh, Good morning, everybody. It's 8:03 actually, and we'll call to order the January meeting of the Douglas County Board of Health, the first initial meeting of 2001 on Inauguration Day. With that, for the record, there's a copy of the Open Meetings Act over here on the north wall of the legislative chambers. Official notification is here. Roll call.
Okay, Espinoza.
Here.
Wilkin.
Here.
King.
Here.
Wade.
Here.
Rogers.
Yeah, here.
Gray.
Here.
And that's all.
Alrighty, with that item C, I have heard no indication of any change, so if it's possible, I'd like to ask for a motion to retain the current officers for another year. There's a motion, there's a second.
Second.
Roll call.
All right. King.
Yes.
Rogers.
Yes.
Gray.
Yes.
Wade.
Yes.
Wilkin.
Yes.
Espinoza.
Yes.
Thank you all. Item 2 is the approval of the minutes for December. There's a motion, there's a second.
Second.
Roll call.
Okay. Rogers.
Yes.
King.
Yes.
Wade.
Yes.
Espinoza.
Yes.
Wilkin.
Yes.
And Gray.
Yes.
Item 3 is public comment. Any public comment from anybody here in the chamber? Seeing none, we'll go on to action items, and there are 3 items. What's the will of the board? There's a motion. Is there a second? Second. Seeing no discussion, roll call.
Gray.
Yes.
Rogers.
Yes.
Wilkin.
Yes.
King.
Yes.
Espinoza.
Yes.
Wade.
Yes.
Item 5 is the monthly COVID-19 update. Dr. Poor.
Good morning, board members.
Morning.
And first of all, this is the first meeting in the new year, and welcome to all of us. I know 2021 is going to be a good one. It's going to be much better than 2020, and I'm looking forward to it. And we have a few new board members, and Dr. Andrea Jones was nominated by the Metro Omaha Medical Society, and this is always the process that we are using, and we used it also in this case. So I welcome her. She may be on Zoom listening in today.
Yeah, she's there.
So I just wanted to give you kind of 3 things. This is first of all, the data where we are at this time, and then
Or zoom in and zoom out right here. There.
but you can see the thing.
It'll automatically.
It'll automatically
Yeah,
go
it'll
away.
it'll
and-
adjust. Yeah.
oh, okay, fine, thank you. So first of all, these are the numbers that we are talking about, and as you can see, can you hear me? As you can see, we have tested now 656,000 tests that have been done. And in total, 303,000 individuals have tested. So potentially, more than 53% of our population has been tested once, at least. We have 10% of those who have tested, 10% of our Douglas County residents who have tested positive, 58,409. 74% of those who have tested positive have recovered. And we have up to now 555 deaths. That's a fatality rate of 0.9%, a little bit less than what the state sees as an average. The bottom curve here, what I'm showing you, is really just looking at what the positivity rate has been. And this now is calculating positivity rate the same way the state is calculating it, which is test over test, meaning we are counting every test that is being done, not only per a person once. Because as you can see, what has happened is people have tested more than once. And it just isn't a good representation if we don't take into account today 100 tests have been done, and of those 100 tests, 10% were positive. If in those 100 tests, however, people have tested twice, we would only count 50 tests, and 10 of those are positive. So it really, as time goes on, this is what the state has doing, this is what CDC is recommending as a different option to test. And so we are potentially at 12% positivity as of today. The next two graphs really just illustrate to you. The top is what the test numbers are. That graph shows you how many tests were done. And what you can see, we are seeing a decrease in the number of tests being done over the last 4 years, 4 weeks, sorry. Where in November we had a very high amount, up to 10,000 tests that were done per week. We are now seeing constantly around 7,000 per week, potentially 1,000 tests per day. So on the bottom here, what this graph shows you shows the number of cases that we have per week. And what you can see, as also the number of tests, the number of cases have decreased. And we saw last week specifically, we saw a decrease in the case count of 34% decrease, and a decrease in the number of tests of 17%. Less tests done, but our positivity rate therefore decreased even further. So that's a good trend. That's what we really hope that we are going to be seeing. We are always interested to look at the age ranges, and in cases here, the age ranges, you can see pretty much the same as we have seen for a long time. We see the age groups 20 to 34 years old at the highest, 31%. And what you see in the age group number 2, we have it even divided up further, because we wanted to know, even when we further divide it up, what are we seeing it. And of course, as you would expect, we are seeing it as ages increase, more cases. Only 1.3% in the very young, increase in cases, but the highest amount, those 20 to 29 years old. And the next one would be 18%, 30 to 39 years old. In the next column, you see a race and ethnicity, and I'll show you another graph where it's even a little bit easier to see. But you can see Asians at 3.5%, African American or Black 6.7%, Hispanic 17%, whites 46.9%, and Native 0.2%. The bottom graph is an interesting one, and you see this on the national base often. That's how age groups are being looked at, and you are starting to see these waves, and hopefully the waves would give you an indication, are there age groups that are being increased or decreased. And what I am seeing, even if you look very closely, is that potentially overall, our cases are going down in all the age ranges, not just one specific.
Dr. Ford, can I just,
Yes.
why is it showing up in,
Say that again,
why is,
Commissioner.
is it January, 1/01/02? Is that 20, and is that 2020? Or
Yeah. No, that's 2021. That's the week that
Okay.
ended on the 2nd of January.
Okay,
You see,
So
those are
three-
weeks.
so 3/14 is 2020?
Yes.
Okay,
Yep.
okay,
Yep.
all right. Okay.
And so this graph is just showing you again by race and ethnicity compared to what our population in Douglas County looks like. As you can see, slightly lower in the white population, slightly lower in African Americans, a little bit higher in Hispanics, Asians slightly lower, and the other races slightly lower too. So Hispanics potentially proportionally higher case numbers than what comparison is to Douglas County in general. So these were the cases, and now the next graph is looking at hospitalization. And the blue line is overall COVID patients in Omaha area hospitals. And what you see there, you are seeing also a very nice decrease in hospitalization. And I think, we are not there yet where we were in summer, and we need to really look out for that. And we have reached a little bit of plateau over the last 2 weeks or so. But I'm also hearing from hospital workers that they are seeing less. It really feels like less burdensome in the hospital. There are less COVID patients in the hospital. And that's, of course, what we are seeing here. The bottom line is those COVID patients on ventilators. And as of yesterday, we had 28 COVID patients on ventilators. That's a good number. It used to be up to 50. And so again, there too, I think we are making progress. And I need to give credit to our healthcare workers who are providing monoclonal antibodies to individuals who are in long-term care facilities. That really seems to make a big difference. And I have to say, not only in long-term care facility, but also other healthcare providers are making it available. And hopefully that has helped in decreasing the hospitalization. This is looking at death by race and ethnicity. And what you are seeing here, you are seeing a disproportionate number, percentages of our death in our white population. African American, Hispanic, they are pretty much as our population distribution is. You're seeing less in Asian, other races less too. So it's a good picture of what our burden of death is in our community. And the bottom graph here shows you where we are in regards to death by the numbers. And you always hear on the national media talking about December was really the month that were hardest for families who lost members. In our community, it's different. It's November. We actually had the most death in November. And in December was the second months that we saw in our community that was really harsh affected by it. And then these last two are just overall. The first one is a case map that shows you Douglas County by zip code, and it shows you by zip code, depending on the color, where our highest cases are in our zip code. And the bottom one shows you where the tests are being done and where we see most of the tests coming from. And you can see that there is definitely a correlation with more testing and more cases being seen. So that's kind of where we are with the cases, and I think we still have a ways to go, but compared to some of the other states, when you hear them talking about, we are in a good place at this time, and we just hope that we can continue on this road, especially as school is starting. There's a lot of concerns in the community. What does that mean? We know OPS is going to go back again and so on. So keep that in mind, and as long as we are, there are lots of testing programs going on in schools at this time to hopefully keep students also safe and realize early enough asymptomatic individuals and what measures would need to be taken. So now I want to switch a little bit, still in the pandemic, but I want to talk to you a little bit about vaccination. You know, it started in December, and I think we all felt happy that this really is now coming. But I have to tell you, it isn't coming soon enough because it's not a light switch that you turn off. And that's kind of what the public feels. They are impatient, they hope this vaccine is here, and why am I not going to get it, and so on. So I want to tell you just a little bit overall. We are in discussions, local health departments are in discussions with the state on a regular basis, like just about every day. How is allocation going to go? How is this all going to work? And we have started in the middle of December with getting doses appropriated to what is our first tier in phase 1A, which is healthcare. And those doses really were provided to the healthcare systems. All of the 3 healthcare systems in Douglas County, they have ultra cold storage. They received Pfizer doses at this time and have received them since then. The health department has started to receive doses the last week of December. And up to now, I just want to make sure that we are realizing, up to now, we have transferred or administered 7,300 doses. That is what we have gotten up to Friday. Friday, we got a new shipment for this week, and that's another 4,000. So the 7,300 we use for emergency responders, we use for healthcare workers, and I'm showing here to you, these are the recommendation for allocation from the state for group 1A. And we are right now, and vaccinated last week, specifically tier 3 here. This is what the health department is responsible for. That means ambulance services, laboratory, pharmacists, a lot of pharmacists, oral surgeons, dentists, and school nurses. So up to now, we have had 15 closed clinics where we have provided vaccination. We have a closed clinic now today at the Christ Community Church. That has been really a good facility for
Dr.
us.
Ford, define a closed clinic.
A closed clinic means by invitation only.
Okay.
That is for these specific occupational group. So it's not for the general public. So these occupational groups have been invited to come, sometimes through their association, sometimes just through our giving out information to them. So 15 of them have been held and have gone pretty well. In one of them, last week was the largest one. We had 1,300 individuals who were vaccinated about within 5 hours. So very quick flow through. What is different with this vaccine versus other vaccine is that individuals need to wait 15 minutes after they have received the vaccine. So we really need large areas where people can sit, and then we have observers there who observe them to see if there are adverse reactions that are occurring in these individuals. I also need to do a shout out to our community who has really helped us. So we have been able to transfer vaccine to certain organizations. Let's say we have given vaccine to the Douglas County Health Center, to Community Mental Health Center, General Assistance, and we have been able to give Coles Pharmacy vaccine to vaccinate long-term care facilities that are not in the general pharmacy program. We have been able to give vaccine to community pharmacies to do developmental disability. We suddenly were brought up that we needed to vaccinate all those with developmental disability who belong to an organization. So that was another 1,400 in the middle of it. We also, all the long-term cares, there are 5 additional ones who were not in the pharmacy program that we also vaccinated. So for this week, we have 3 clinics planned at Community Community Church for the 4,000 we have received. And we are going very strictly through this list. So starting on Monday, next Monday, we are potentially, only the health department is going to get doses. No more to the healthcare system, because the healthcare system are finished vaccinating their healthcare workforce. So it looks like we are going to get into Douglas County on January 25th, approximately 6,650 doses of vaccine. The health department then makes decisions where those doses are going to go, how they are going to be divided up. And, 6,650 is not a lot of doses. Probably for us, at least, it means finishing Tier 4 and also going into Tier 5. Hopefully by the end of January, but it may be by the first week in February, we are done with vaccinating these groups. And what is happening then
Phase
is
1A groups. Phase 1A groups.
1A, yes.
What week did you say, Dr. Port?
Pardon?
What week? You said the week of February, first week?
The first week in February, yes. So that's when this phase 1 prioritization comes in. And that phase 1B, as you know, has changed completely. It used to be 75 years and above, and we had plans and we knew exactly how many people that was. And then it was changed to include those 65 years and above and those with high-risk medical condition. So that added another 45,000 potentially for us, plus those with high-risk medical conditions. But as you can see also here, and that's important to know too, is we do not have to finish completely that tier before you see that that is ongoing. And we can slowly move into Tier 1, which would be first responders, utility, homeless shelter staff, correction staff, and educators. But in this tier, according to the governor, you are not one within the tier, but your priority is first responders, utility, homeless shelter staff, go down that list. So often we hear, the public is trying to take the information they want to hear. This has to be step by step. And so it does sound sometimes a little bit disjointed, I guess, but this is what the governor and DHHS want us to do. After that, you have Tier 2, funeral home, grocery stores, food processing, mainly meat packing, food processing plants and co-ops are in there. And then Tier 3 is transportation, U.S. Postal Service, and public transit. And only after that are we getting into Tier 2, which is for the general population. So as you can imagine, when you look at the numbers, this is a large group that we need to start vaccinating with a very small number of doses, 6,650. And I heard yesterday the state say that they are foreseeing that first 65 and plus could take 8 weeks potentially, 8 to 12 weeks or even more to vaccinate. So that's kind of where we are in this process. I think all of us are hoping that we are going to have Johnson & Johnson come on with a new vaccine. That trial seems to be ending pretty soon, and then they need to go for emergency use authorization. That would be a 1 dose only, because as what I shared with you, as of this week, we are starting already 2nd doses now. Because we already have emergency responders, healthcare providers that we vaccinated, and now 2nd doses are coming along. We also are realizing a lot of people, everybody gets a vaccination card when they go and get vaccinated the first time. That vaccination card clearly says, which vaccine did you get? Did you get Pfizer? Did you get Moderna? It tells you the date, and it tells you when to come back for the 2nd dose. What we are hearing, people are misplacing that and are losing those cards. So that's another little dilemma. What I want to share with you too, that all this information has to be put into the Nebraska Electronic Immunization Registry within 24 hours after we have given the vaccine. So we have hired or received yesterday 10 National Guard people who are doing nothing else. They were trained yesterday. We trained them the entire day. And from now on, they are just inputting data. Because that also is a factor that why you see sometimes the discrepancy on the state dashboard that is between doses allocated versus doses administered. Doses administered are only those doses that are in the system. And so it is really important to get that information into the system, because so often the public thinks we are sitting on doses. No, we are not sitting on doses. We are getting them into arms as quickly as possible. And so then yesterday, I think you saw in the paper, the state has always talked about having a digital solution through Microsoft, actually, where people could sign up for these vaccination sites and could make an appointment, and then it would potentially, with a QR code, would directly go into Nessus, and we wouldn't have to do this manual entry. Well, the system has taken a little bit longer, and so potentially next week, that system is going to be able to stand up. But in between, we needed to do something, because we realized that the public has a lot of anxiety about, they want to be on a list, they want to be kept informed. So yesterday, as you saw, we set up a system, Sign Up Genius, and individuals can go on our website, and there's a clear link there to sign up. It's very easy. It's 2 clicks to do it. We had already more than 6,000 individuals who have signed up. What the sign up does is they are providing us an email address, which we then will respond to when these community sites are open and when we have enough vaccine. So it is good for that purpose. We also are hoping that we are able to link up with the state system when that goes on online next week. So I think a lot of planning, but a lot of planning you can do ahead, but it always looks a little bit different when the incident occurs. And I think that's what we have seen here. We had to step in and get this program up.
Dr. Poor?
Yes.
So for the website link, it's just a website where they can sign up for information, but not necessarily signing up for anything else.
They are putting their email in there, and so then their email, first of all, gets a confirmation. Yes, you have signed up, Dr. King. And then when we have that email, we'll see, are you 65? Because you have to put your age or your date of birth in there. We see if you are 65, and we'll send you a note and say, Dr. King, now you can sign up because now the sites are open for 65 and above.
Oh, okay, thank you.
Mm-hmm.
There's
The
a
other
question.
thing, what we are also doing is a volunteer management database because we do have a lot of volunteers that are stepping forward and are saying, you know, we want to help. But this is a whole management of volunteers. So next week we are piloting this volunteer database. We have an internal staff person who is going to oversee all this. So that's kind of a lot of discussion at this time with our healthcare providers in our community and the big three hospital systems. What is the best way to really address this large population? Because what you are seeing in rural Nebraska may not work for us here. In rural Nebraska, a lot of vaccination of those 65 years and above and with healthcare conditions is probably going to occur in the doctor's office. Our healthcare providers, especially in Omaha, not so much in the surrounding counties, but in Omaha, they are very hesitant because they are afraid that their clinics and their offices are going to be overwhelmed. More thinking of it may be better for them to have a centralized site together with the health department. So we are in discussion about that, and we'll move forward with it so that we have something in place come February.
Dr. Ford,
Yes.
they're asking if, once you've received the first vaccination and you get the card, are you automatically signed up for the second vaccination and guaranteed the second one?
Yes, you are. Let me share something. The first doses that come into the state, there is always a second dose for that person. But let's say your day is to come in today for the second dose and you didn't come. We wouldn't hold that dose back for you and waiting for you. We would give it to the next person to come in. But there always should be enough second doses for those who have received first doses. But the issue is now, are there some people who wouldn't want to take their second dose? And how do we find out about that? And so there is some leeway that we need to think about that as we move forward. But yes, your second dose is ready. If you got your first dose, your second dose will be there for you too.
Is the second dose the exact same thing as the first dose?
The second dose needs to be the same vaccine as the first dose. So you cannot mix Pfizer at the first and Moderna as the second. It needs to be the same.
Okay, so Cindy, just, if anybody's got any questions, tell them, I'll come to you at the end and just get them all out at once.
Okay.
You're welcome.
Did you have any other questions?
Yeah, I do, but I'm waiting to let you finish.
The only other thing I want to say, probably share with you, we have now reviewed 97 opening plans for this community, big events or so on. And remember, depending on the phases, they always needed to show those plans to us again and be approved. Also, our call center, and I cannot say enough about the information line, they have received now more than 30,000 calls since we started the call center. And needless to say, yesterday they had the highest day. They had 485 calls. These are individuals who are calling in, I want to sign up, what do I need to do, but also have questions in regards to exposure, quarantine, and isolations. So again, we are adding more staff to that information line as we move along. But that's about all I have to share with you today on vaccination and coronavirus.
Marty,
Dr. Poor, what's the current status of the vaccinations for the Douglas County Health employees?
I'm having difficulty understanding if
the status of vaccinations for the Douglas County Health employees.
for the health department employees. Right. So health departments are actually public health is in. I thought other public health workers. Yes, it's right. in tier 5 of phase 1A, as you can see it here. Other public health workers.
Okay, so on tier 1, phase 1A, under COVID-19 vaccinations, it says local public health, pharmacist, internist. So
correct. So that is for those who vaccinate. That is for the nurses who are out in our clinics vaccinating, and those were the first groups, as you can imagine. Yep. Dr. King.
You done, Mark?
Yeah. Oh, are you finished, Marty?
I think so. Okay. What you're saying right now is that other than the individuals within the Douglas County Health Department who actually administered the vaccinations, the rest of the employees are waiting to get their first vaccination?
Correct. Okay. We'll be waiting. Now, there is something that we have done because the governor was very strict in saying we don't want to waste a dose. So sometimes we have a clinic, and at the last minute, one person comes in and we have to open a vial, and then we have 10 more doses or 9 more doses in that vial. We come back and we have an internal list with phone numbers, and at 6 o'clock your phone may be ringing and says, can you be at the health department clinic within 30 minutes? We have 3 doses left. And so that's how we started to go through our staff at this time.
Okay.
So I was noticing in phase 1B that in tier 2 is the food processing, which I was a little shocked by considering the rate of infection with COVID in the Latino population, and they make up a large or significant proportion of the meatpacking plant employees. So I'm just curious as to why they aren't going to be vaccinated sooner than tier 2, especially, again, with the death being disproportionate to the county population.
You know, those were kind of discussions that first came from the ACIP, which is the CDC recommendations. They came kind of with that tier. The governor made a few changes in it, and we provided some data on it. And these were the tiers that were. You know, everybody wanted to be in, of course, highest priority, and we said there needs to be some time, something. And I can tell you, you know, a shout out to the meatpacking industry. They have really done a good job in trying to keep their employees safe with the measures that they are putting in place. And so, you know, it's just a function. Somebody needed to decide what tiers they belong into. There are a lot of questions I'm getting from the educators, why they are not higher up either. You read the paper, judicial judges are asking, why are we not higher up? So law enforcement is actually very much unhappy that they are now, those 65 years and above are above them, and they are wondering when they are being vaccinated and so on. So it's all those factors that are playing a role. I agree with you.
Thank you.
Anyone else? Dr. Poole, okay, let me ask you. So when you said on that, you said in phase what you get on the 25th, we will get those vaccines, and we will be in charge of, I just want to make sure we're in charge of doing those vaccines, the ones you get on the 25th, the 6,650.
Correct.
So who did the health systems did tier phase 1A, tier 1 and tier 2, the health systems did their own.
Good question. So in the beginning, the state allocated those doses directly to the health systems. They didn't come to local public health. They came directly to the health system because those were large amounts. They were Pfizer vaccine also, which we knew we couldn't take care of. Actually, at this time, we have already an agreement with Nebraska Medicine to be able to store the vaccine because we do not have ultra cold storage. But in the beginning, there was a direct shipment to the health system, which will change now.
Okay. How does I'm just curious, how does the volume timeline, the vaccine timeline work? Meaning, is this similar to like a measles shot that you get when you're young? You get it and it's good for a certain amount of time, or are you gonna have to get this like the flu shot? I think I heard it, but I haven't heard a definite answer from anybody.
Yeah, it's a good question. So what you are asking, how long does immunity last, and do we need with all these variants that we are hearing about now? So now you may just have heard where we always used to say, at least you have immunity for 3 months. It seems now some researchers are saying it's probably longer. When you had COVID, it's probably 6 months. But I do think, Commissioner, to your question, that has not been answered yet. Is this on a yearly basis? I think it will very much depend what we are seeing in the next few months, if there are more variants going to come, and are these vaccines specific, or are they broad enough so that they would cover all those variants? I think research needs to be done on that, and the word is out.
So, just in thinking about this, like my personal thought is, we need 75 to 70 to 80%. Is that the number for herd immunity, or is it 60 to 80?
Yes, I'm saying 65, 70. Often you hear, yesterday I heard 70 to 75. So everybody has a little bit different numbers.
So, I just say this to what you said about the immunity level. I guess I'm just trying to really, because that feeling's out there too, like, to try to combine some questions. My kid had a game out at OSA, and I went into the parking lot, and I was like, what the hell's going on? And I guess I forgot that the limits have got up, and some private businesses have changed the way they're doing things, and it's almost like just the announcement of the vaccine has made people start changing, and not a lot of people have gotten it. And so I just say that to say, do we need to start just getting people to saying, because I think there's a feel that people think that this mask mandate and everything is about to drop, that there's probably been a permanent culture shift. This probably needs to be there. Now, people may not like it, but I don't think you're going to be mandated. But I'm almost thinking, is there some permanent campaign now for masks? Because you may not mandate it, but this thing is still totally not going, and it seems like it could pop up at a minute's notice.
I
don't know
agree
if
with you.
I don't know if you understand what I'm saying.
It's a difficult message.
Yeah.
It's a difficult message, and we had a good discussion yesterday, because on the one hand, you are saying vaccine is here. On the other hand, you are saying we still need to take all the precautions. And I do think you can look at it from a personal level, and you can look at it from a community level.
Mm-hmm.
And if you are looking at it from a community level, you need to say we still need to wear masks, because the community as a whole has not been vaccinated enough and didn't have any enough COVID cases so far. So I think that's where it goes, where you as an individual potentially, if you have been vaccinated, and your whole family has been vaccinated or two families have been vaccinated, you may say it's easier for us now to be together as a family if all of us have been vaccinated. But again, that only is for a small group. So as a community, I still think the same precautions as we had need to be in place, fortunately or unfortunately, for the next 6 months, I would say.
You think okay? I mean, I almost feel like we're in the realm of we almost like we are. I felt like it was in '02 when the board declared STDs a crisis. I mean, I almost feel like a mask is in the same realm as use protection for STDs now. At least probably for a little longer, 6 months. But I just wanted to note that here because I do think, people need to start saying that, preparing them for this. I mean, to cross questions. It's like, I don't know if this is justification, but I mean, knock on wood, usually at this time of the year, I would have had a severe cough, a runny nose, severe sore throat, and I haven't had any of that this year. Probably just because of the mask and the hand washing and other stuff like that. So, and I know that in that report, there's no designated influenza deaths so far. So
That's right.
I almost think like, I mean, it's hard to get out of this crisis, but I almost feel like we're not honestly telling people that you might have to do this for a while. Not mandated, but you're gonna have to do it. I almost feel like we got to start softening the ground a little bit. Is that fair?
I mean, the point that you are bringing up in regards to flu is an interesting one because we are seeing so few cases of flu. And it is those behavior of hand washing, not touching your face and so on, and wearing a mask are really helping us prevent other respiratory diseases too. And so, individuals who may say, well, what is the mask's benefit? I do think we see the benefit already by wearing a mask. And yes, this could be longer, but I do think, Commissioner, there is hope that potentially some of these restrictions can be loosened up. We know how important it is for all of us to get together again and communicate better with friends and so on. So I do hope, and I'm very hopeful in seeing the interest that this community has in being vaccinated. That's not what you see sometimes in rural Nebraska, where they already have seen some healthcare providers very hesitant of vaccination. And so therefore, in those communities, what you have seen is they have had vaccine left over, and then they went further into the tiers, further down. And so, when you hear communities, there are communities, I think Grand Island is one, North Platte is probably the other, where they have already started vaccinating those 65 years and older. Even so, the allocation is pretty fair, distributed by per capita. So we get 29% of what the state of Nebraska is getting is coming into Douglas County. So,
Okay, Dr. So can I switch the question to your sheet on, so why is the number of testing all of a sudden going down?
say that again.
Why is the number of testing all of a sudden going down?
Why is the number of tests going down? Or you could say you could turn it around. Why was testing increased in November? Because what you are really seeing, you are seeing increases in November. And now we are back to potentially October levels again. And, there are a lot of hypotheses that go along with it. I do think a little bit of fatigue, that I do not need to get tested. I don't feel I have exposure potentially. But also we see the cases go down. Not only, and we see the cases go down further than the testing. If we would see that on an equal level, I would say less testing, less cases. That's not what we are seeing. We are seeing less testing, even fewer cases.
Mhm. What's you all's thoughts on the numbers of, um, you got decreased testing, and then like the number that still puzzled me, and I guess even our Thanksgiving and I guess remdesivir and the monoclonal antibodies take some credit for the hospital stays. I don't exactly think that's the right measurement, but I think I'm just trying to, how do we take this number, the still the puzzling number for me, and I just have to give some credit and take that the community is doing good. Like I've been amazed at like the black positive number. It's never went over the percentage, and it's like just tremendously lower. And I'm trying to figure out how do you take this number with the decrease in testing numbers, and then you just take the rate that the Latino numbers have dropped. I mean, how should I describe this with the test numbers dropping and those percentages dropping at those rates?
I know. I actually looked last night, Commissioner. I was trying to see over the last 2 weeks.
Mm-hmm.
Just take data from the last 2 weeks. And when I look at gender, over the last 2 weeks, 2.5% Asian, 4% Black, Hispanic 11%, and white 54%, and others a few percent, and some unknowns in there. So I'm really surprised at the percentages of the cases in some of our minorities. I think we all agree that in the beginning we had these high percentages in the Hispanic population because they all came out of meatpacking. I want to say, you know, when ICAP and University of Nebraska Medical Center, the Global Center, then visited those meatpacking plants and put out very strictly what needs to be done to have infection control measures in place. And I think the meatpacking industry actually did quite a bit of investment to make their workplace safe. And we are seeing the same in long-term care too. Not only meatpacking, long-term care in the beginning really had a high death rate in long-term care until ICAP went in, looked at infection control, said you need to do, put those that had exposure into that area and the others quarantine them over there. I do think those measures had an effect. And if you remember, Hispanics were 54% of our cases the first few months. And look where we are now. In the last 2 weeks, 11% of the cases. So I think what I'm saying, it does matter. The environment does matter, and we can make changes towards the good. And that's what you have seen when industry comes together and is open to make changes. And that's what they are, because they are realizing it's for their own good, too.
Okay. I got one last before I turn it over and come back. So page 1 of the summary, explain to me again, just so I can make sure, the difference between the red and the blue, the positive by reported date and the positive by test collection date. What's I'm trying to get the distinction again.
Okay, so the positivity rate you can use in 2 ways. And what you are seeing on there, on that graph, is you are seeing the positivity rate. You are seeing 2 dots, actually, and 1 dot is by the collection date. That is when the test was collected. And 1 is by the report date, when the state is reporting the data to us. So you are seeing a slight variation, very slight in those 2. But the other way, when we talked about 33% of our population is positive and so on, that was when we deduplicated. So Commissioner Rogers got tested in February, and he tested 10 more times after that. We don't count those 10 more times because he was negative. We only counted 1 time up in February when he tested. But now, so that is what we are calling person over person. And as time goes on, that measure is good in the beginning, because in the beginning, most of us have tested once. So that makes a lot of sense. But now, as time goes on, many of us have tested more than once, and we are saying we should be in that count. It should matter to me. It matters to me to know there were 10 tests done in Douglas County yesterday, and only one of them were positive. I do not care if those 10 people had already tested once before. I want to know what is the positivity rate in this county. And so that's why test over test, I think at this time, is a better measure.
Person over person is removed of duplicates. Test over test is just adding the number of tests.
Yeah.
Okay.
Exactly.
All right.
Dr. Poor, what has been the discussion related to the 2 new COVID virus strains that have been identified?
To the what?
The 2 new strains of COVID that have been identified?
Yes, there too the information is changing quickly. So the thought is, what researchers are saying is, it's a variant that has a higher transmission rate. And that's what they have seen in a southern part of England. But it is not that they have seen more hospitalization or more death with this variant. And so what we are saying, yes, potentially we could see more cases, but what is the burden to the hospital systems and the death? Potentially less. What they have also found is that the 2 vaccines that are being used now under the EUA, that they are effective to this S deletion of this variant. So they have seen that this vaccine is broad enough that it also will be protective, that it also affects that virus. That's what we know now. We also know now that there are probably more variants coming on. There are variants out of Africa that is coming on, and so on. So I think what is difficult for all of us to understand that we are learning as we go. This is really what is happening at this time. We learn new things every week, I tell you, and if you don't keep up, you have already missed something. So it's a very fast evolving field at this time.
And is because of the 2 new variants that have been identified, and there are a number of states here in the United States that have identified one of them, at least, is my understanding. So the rationale for continuing to wear masks, because we don't know for sure of the protection of these 2 new strains. And I think that's what Dr. Fauci was saying in terms of we need to continue to wear masks.
And
well, for other reasons besides that, but.
That's a really good point. We have laboratories now in Nebraska who are also looking for this variant. We haven't seen it yet in Nebraska, but it has been in our neighboring state, Colorado, and I would suspect when you start looking for it that you are also going to find it here. But you are absolutely, another issue why we need to continue to wear a mask and wash hands.
So when an individual goes right now to be tested, the laboratories in Nebraska will be able to pick up if it's the COVID variant as well as
some of the laboratory, not every laboratory, will be able to test. Some of the national labs that are also testing in Nebraska are already doing it. Our Nebraska Public Health Lab is also working up to it. So yes, there is starting to testing to be going on.
Dr. Poor, not so much. Wow. Okay. Let me stand back a minute. This is not so much a question as much as it is a statement. Councilmember Festerson and I have made a request to law, and it will be on the agenda for next week for first reading, but we intend to extend the mask mandate to the end of May. It'll be a 90-day extension, And I think it's going to be important for that public hearing, which will be, I think, February 1st or 2nd. I don't remember which day that Tuesday is. But I think it's going to be important, probably more so this particular time, that, we have people there, yourself and others, so that we can, because I think the discussion needs to be why we still need to, have a mask mandate. And, lay out some of the statistical data that currently exists, and remind people that, even though you've had the shot, you still need to be protective of others. I mean, the things that need to be said, and in this particular instance, because I can imagine that there's going to be, I think people are getting tired of us introducing a mask mandate, but, I think this time, I think we can give some hope to people, but at the same time, I think we have to, recognize that wearing a mask is still necessary and probably will be necessary. People think, that sometime maybe in the spring, I'm not sure that we're going to be out of this anytime soon, including in the summer. So, we're going to extend, but I just wanted the board to be aware that that agenda item will be on our agenda next week for first reading, and the public hearing will be that following week. But we do intend to extend the mask mandate to the end of May. Thank you, Mr. Chair.
Thank you.
Celine?
Oh, Ben,
Yes.
just a question. What is it about the end of May as opposed to extending it indefinitely until?
The
we get
thinking,
data?
the thinking among council members and some of the, and others that we have talked to is that we want to kind of do a measured approach, as opposed to, doing some blanket sort of thing for like six to 8 months or something like that. We want to be able to be in a position to revisit it, but we want to be in a position to revisit it in a way, that we have done all the due diligence necessary once we revisit. So the reasoning, the thinking behind, the 90 days is specifically that, so that, we can take a measure, we can continue to take a measurement, but, we have been very clear that we're going to follow the science. And the council has been very clear about that, and I think we're going to continue to be clear about that. But I think every time we do it, I think there needs to be just that ongoing discussion about things like herd immunity and other areas that we need to talk about as to why we need to do it, what the end result could be, and how it's going to be beneficial long-term for the public.
I have a
Celine?
few thoughts if able here. It's Dre Jones.
Wait a minute, who's that?
Someone on Zoom.
Oh, hold on, Dr. Jones. I'm gonna run through the board and I'll go to the Zoom call. Celine?
Dr. Poor, I have received both of the Moderna vaccines, and I've had a really positive experience with it. So I'm really pro-advocate for vaccination in our community. There's a couple of factors that I have faced within the Hispanic community. Not only the lack of understanding the science behind the vaccine and the fear of permanent medical symptoms or effects for receiving the vaccination, but also there has been a rise of anxiety within the community because of comments that were made that immigration status or awaiting an American citizenship would therefore lack the access to a vaccination if you are awaiting any sort of permanent status in the United States. Would you please confirm that that will not be a lack or a factor that you will be able to receive that vaccine when it comes available to specific meatpacking employees and general public in the Hispanic community?
So that is a good point, Celine. We have made it very, very clear that in any of our site, we are not asking for any documentation. So that should not be a fear, that should not be a barrier for anyone. We want everyone who lives in this community to be vaccinated. We have tried to put a news release out in that effect, and we'll do it more. So if you hear about it, that people feel like that is not the fact. Everybody can get the vaccine. No documentation is asked for. At the same time, since you are giving me the platform, I just want to share with the board, Celine has done a great video in regards to getting her vaccination, and we'll send the video to the Board of Health. There's also Creighton University, the Center for Health Disparity. They have also done a very nice video for the funding that had been provided to them to use and educate 50 health advocates in the community. They have done a video of it, and I will share that with the board at the same time.
Thank you, Doctor.
I'd like to also add that the North Omaha Community Care Council has done 3 PSAs advocating for making sure that we are social distancing as well as wearing masks and vaccinating when possible. And there are a couple more coming to talk a little bit more about vaccination, specifically targeting the Black community as well as other North Omaha residents.
Okay, let's go to Dr. Jones.
Thank you. Just a couple of thoughts in listening to this, and I thank you all for your time. First of all, with the Sign Up Genius, I do have a few concerns about, is there like a backup method as far as, can someone provide a phone number if they, especially individuals over 65 who may not check their email as often, and is there a time-sensitive nature to them responding to this?
So the question is, do we have a phone number? We do have an information line, but I don't want that line to be overwhelmed with calls like this, because they really need to answer calls in regards to exposure and potential quarantine. But what we are saying is that there are those individuals who are not computer savvy and want to sign up on the list. They should ask family members, or they should ask organizations to help them sign up. So that's kind of the route we are going there. So that, because what is it going to do if we are going to have a list with 1,000 people on there with a phone number on it that just isn't responsive to the public. So we are asking family members just to help each other and get your grandma or your grandpa enrolled on this list if they want to be.
Okay. And also I'm working on a lot of my staff in clinic who may have some vaccine hesitancy and kind of want to wait. So many of them have opted to hold off at this time, but if they do decide to go ahead and get the vaccine, are they able to then sign up if their tier has already passed?
So the question is for those healthcare workers who probably the first time around are saying, yeah, I'm going to wait till my friends are getting vaccinated. Yes, there is a chance. We always want people to be vaccinated. I think what I would say is then just be sensitive that you are not going to be right then the first online if you are waiting when you had your first chance. But everybody should be able to get a vaccine. Yes.
So, Dr. Poole, on her question, I thought I heard it was like an airplane line. Say you're in first class and you missed the call for first class, and they get to star membership or phase 1. I heard if they're at phase 1, because you were first class, you can still come because your name was already called. Is that fair?
Yes, that is a fair assessment. But when you are asked, you are late to come.
Mm-hmm. You just get in when you fit in.
You just get in line.
Okay. So, Dr. Jones, let me ask you to your question. Is there some monitoring or some way that you're able to tell if somebody's having that trouble, that you can let us know if that's the case, to your first question? Or is that just you just asking, do you have some way of measuring if that response, if that's a barrier or not, that you can get back to us?
personally, with my patient population, if I have medical assistants that are rooming my patients and they haven't been vaccinated and they happen to be talking to the patients, like, about getting the vaccine, I'm trying to work on the medical assistants to get the vaccination. And so I'm hoping that eventually they will be willing to do that. But at this point, I just want to have options so I know where to send them when they are ready.
Okay.
And then also, I just encourage people to take a picture of their vaccine card just as a backup. Most people have a phone available. So if they do happen to forget their card, I know that helped me, just to make sure you're getting the same vaccine for the second dose.
Okay.
I think that is a really good recommendation, Dr. Jones, to take a picture of their card. So, yep, I would encourage them to do that.
You good, Dr. Jones? Anybody else online? Questions? Any other board members online? Okay. Dr. Ford, can I ask you while you're up here? Can I ask you some questions that's in the report just to make sure? Unless you're done, or you got?
I'm done.
Okay, so is Carol on there? Is Carol on the call, or somebody that can answer this? Okay, so Carol, let me ask you in your report, explain to me this transition to Salesforce and what that is.
Okay, so can you hear me?
A little bit.
A little bit. Maybe I should, let me make sure I've got my sound turned up. Okay, the state decided that they wanted to implement a new system for case investigation and contact tracing for COVID. We had a lot of concerns about it because it's changing in the middle of a pandemic. But the state was going to make sure that all of their contracted tracers, which help us, were going to have to move to the new system in the first group that moved over. So it meant that we, as a health department, had to move over to that new system as well. So it's been a challenge, but we are using the new system at this point in time and working closely with the state with some of the challenges and some of the issues that we have noted with the new system.
So was it always a statewide system?
No, this was a brand new system.
So
We always used a statewide system. We were using the Nebraska Disease Surveillance System, or NEDS, for the most of the counting of cases. But the investigation information we were putting into a survey system known as REDCap. And this, like I said, the state made a decision that they wanted to implement a new one. So it's brand new. Salesforce is actually kind of a call center based database system. So there's some challenges in there because public health doesn't generally work like a call center, but we're working very closely with the state on that.
So I just want to make sure, Carol, the first two systems you mentioned, they weren't like when you do the first one and you enter into another one. Those weren't was that specific systems to Douglas County, and now we're on a statewide system, or did we always have a statewide system from the start?
The other two were statewide.
Okay. Okay. So this call, you got me on this call center thing. The last time the state had a call center issue was with Department of Labor, and people were waiting 2 hours to get somebody there. Is this a similar issue you have?
No, it's not set up like that.
Okay, all right,
Anything that's reported flows into the system, and it's the allocation of the cases for follow-up that's a little bit more like a call center system.
okay,
But other than that, no, that's not the case.
okay. So, so Dr. Poole, in some sense, the state is owning contact tracing.
Well, Commissioner, over time, I think we have seen these systems that public health used are smaller systems. So now we are suddenly stressing these systems with this a lot of data coming in.
Mm-hmm.
So what we had 4 different systems. We still do, us, local, and the state. So what was decided is to go forward that the system we were having, called RedCap, was too small a system to use. It took 2-3 hours to download data every day and so on. So what did the state do? In the middle of a pandemic, they decided to switch the system and go to the Salesforce, which meant a lot of new training. These systems usually take years to be developed. So you are developing something very quick. You are taking most of our staff in FB away to help us develop that system for the state so it works right. Right now they are troubleshooters. They are the troubleshooters for this big system. In the end, it is going to work, but it is, I question if timing was the right time to make this change. I think that's the frustration you hear from some of our staff.
Yeah, I'm trying to ask it. Well, I mean, basically, yeah, I just feel like, okay, the state, you own contact tracing now. So it's like, I mean, to their credit, when the issue happened, they fell on the sword for it when it was happening earlier. But I'm assuming when all that was just transferred. But, when you do something like this, I'm assuming, you take ownership. And I just want to put that on record that I just think people generally need to understand it because the contact tracing thing is it's fell off its emphasis because of the vaccine, but still it's a piece that needs to be out there. And I just wanted to tie that together a little bit for the public that may be here.
But Commissioner, the systems have always been a state system that has transferred data to locals.
Uh-huh.
So you could always have said contact tracing, it's a state function or something, because it comes out of those systems.
Okay.
I do think I would like to give the state of Nebraska credit. In regards to contact tracing, this state has ramped up a lot in having 1,000 contact tracers in place pretty quickly. We couldn't have done that locally. And so the state contracted with some big companies to do that. But what we are seeing now are a little bit growing pain. And like I say, in the middle, was this the right time? It needed to be done. I understand completely, but you can always question a little bit. But we'll move forward and we'll try to do the best. To me, at the end of the day, the importance is that we get the data and we get accurate data as quickly as possible and as efficient as possible.
Okay, so my last question is for Carrie. And it's basically, so what are we thinking with the life of this call center? Because it just seems like it's taking on a life of its own. And I'm not saying in a bad way, but it's become this instrument that wasn't there before. And when I see this call center and I see some of the numbers and some of the stuff that's going on with it, I feel in the back of my head the changes that happened when 9/11 happened and the changes that happened to public safety. This is one of those changes that's going to be post-pandemic for public health. So I guess I'm just putting it on you all's head for some thought about what's the life of this thing afterwards. Where does it go? Because you got this, you got 211, and I just think you all need to give some thought to that because when I read it, and this is just me, it looks like it is something new. That's a new leg. So I just put that out there for you all to think about, to see how this reads in the future.
I let Carrie talk about it, and then I'll share with the board something really kind of nice. You all should come and do a visit of our information center. We just finished it. The cubicles that are really in between, they are soundproof and so on. So it's really impressive. It makes work down there in our conference room downstairs much easier. But Carrie, I let you respond to commissioners.
Well, let me give you an example, Carrie, before you respond. So, yeah, and I need to come down there and see it, but when I read this, so I see post-pandemic, and then I see this housing ombudsman, and then I see this being a soft, non-threatening call, not to a city inspector, but to public health at this line saying we got some issues with housing, and it's a little softer deal. I don't know. That's just where my head is. So, Carrie, that's what I'm trying to see. What's your future thought on this line?
You know, you raise a good point. I think, the one thing I can say about this team is that they have the ability to pivot so quickly based on the questions and the concerns that are coming into the call line. So, heavy on COVID earlier, a lot of questions around that. Then it was around the exposure and testing. Now it's around the vaccine, and they're still getting all of those previous questions. But I think as it relates to what this transition will be through the, as we get these positive tests and then the call center and then connecting to what is happening with the navigation team, yeah, I think you raise a good point. I don't know what this is going to look like when we get toward the end and, the call volume dies down, or maybe it doesn't. It just continues to morph based on the needs of the community. So, it's certainly a good question to raise for thought.
All right. Then I know it's hard to do in the pandemic, but somebody needs to give some thought to articulate that particularly next coming year.
I've been thinking about it a lot. I really think we can use that ability, and like you say, a lot of things have changed lately, and so we are kind of known in the community. People can call in and get some good advice, and that advice does not need to be related to COVID, but it could be related to another public health arena.
Okay. All right, item 5 is done. Item 6, no presentations. Item 7 and 8, no reports and updates, but let me say update-wise, hopefully you all were able to tune in for the for Creighton's Unity Prayer Luncheon. And again, congratulations to the department for the award and the board. I was thinking they would have that award here so I can give it today, but they haven't, so I'll give it there. But again, I just want to congratulate the department on that and all the work. Other than that, I know I mentioned last month that we would have some executive sessions. I think this month there's just a lot of transition with leadership changes, so I held off, and the vaccine stuff, so I figured there wasn't a lot there, but I would just for everybody plan on it next month. Now that things are a little like beginning of the year, leadership changes and roles and things like that are set, we can talk about it a little bit more next month. So other than that, unless somebody else has some other questions or things of that sort. Okay.
Commissioner, are you
Yes,
giving me a
ma'am.
second? You have a handout with all the legislative bill, because today is actually the last day where bills are being introduced. And I just put this in front of you to take more as information. And you are seeing the action that we put on there. These are mostly bills that have been put forward by the lobbyists for local public health, that they have potentially or could have potentially a public health impact. Many of them, I think, are bills that we will follow, but not really do any action to it. However, there is one so far that I would like a little bit your attention on it, and that is LB 115. that Senator McAllister is introducing. It is imposing a sales tax on candy and soft drink, and it provides for the money would go into the healthcare cash fund. This is a bill that we have seen before, and I think before you as a board felt we could write a letter of support to the bill. I just want to know how you are feeling at this time. Things are moving very quickly. They are changing a little bit the process. So on the week of the 25th, which would be next week, they are already going to start with their committee hearings. They are going to be in the morning and in the afternoon, quite different from what they have done so far. So I think we are coming forward very quickly. So that was one question I had for the board, if you will feel comfortable with me doing that.
Yeah, can I make a point though, at least personally, Dr. Ford, before I open up? I think before when this introduced, I remember the history was Avery's. They were trying to give it to schools. I think that the Friends of Public Health should push for this to go directly to public health. While you have the advantage, because giving it to the healthcare cash fund is just spreading it over an issue that there's some relevant beings. But right now, you have the leverage, and I would say that they need to talk to McAllister about doing it straight there. That's the source. I mean, they can do the healthcare cash fund out of tobacco tax, but this needs to be, most places that do this, it goes to public health. Okay. So if they're gonna do this sales tax thing, right now, that's the source where you need to fund and beef up the public health departments now that you see the issues in it. So I would tell the Friends that they need to be all out on, no, you don't need to water this down to other people. You see what our need is, and this is gonna be here. So that would be my only piece on that.
I think that's a good point, because LB 459, which is increasing the tobacco tax, and it's introduced by Senator Kavanaugh, and she already has decided where the funding is going to go. So what you are pointing out is really a good point. I would tell you that Senator Vargas is introducing two bills today. One of them is for public health. Remember last year he introduced a bill. He actually wanted to get $6.5 million to public health, to all the 18 public health department. He only got 1.5 million. So this year he's trying to finish that, and he's going to go and ask for another 5 million so that we would be whole for that 6.5. He definitely is a public health advocate, and he has seen what the issues this pandemic can have. And the other bill that he's introducing is to potentially let local public health departments have the authority to put DHMs in place, because I think we all have seen that it was very cumbersome at this time. So potentially that is, I haven't seen the final bill yet. I have seen a draft of it. That's what he's going to introduce today, those two bills. The moment I have them, I will send you a copy of it. Thank you.
Thank you. Seeing nothing else, is there motion to adjourn? It's motion second. Roll call. Yes. All right, thank you all. See you next month.